Hi, I'm Isabella Brown, and today we'll be talking about nutrition for Hashimoto's disease. This video is not meant to treat or diagnose, so if you do think you have Hashimoto's disease, please go see a doctor. This video is just meant for nutrition students or registered dietitians who want to learn more about treating their patients with Hashimoto's disease. I'll start by giving you an overview of Hashimoto's disease. It is an autoimmune disease where the immune system attacks the thyroid, leading to inflammation of the thyroid and eventually hypothyroidism and goiters. Remember, hypo means low, so it leads to low thyroid function. This disease mostly affects women. It can be caused by an infection from a virus or bacteria, and one of the reasons it's important to eat pasteurized dairy and properly cooked food, and use good hygiene when cooking or eating. Other possible causes include radiation exposure, environmental toxins such as PFAS, BPA, heavy metals, and pesticides in large concentrations. Intestinal permeability, otherwise known as leaky gut, inadequate iodine, and pregnancy can also cause Hashimoto's disease. In some cases, after giving birth, women will have an inflamed thyroid, which can lead to Hashimoto's. Nutrition-related symptoms include fatigue, weight gain, joint and muscle pain, constipation, and bloating. This may make it difficult for your patient to work out or eat certain foods comfortably. Hashimoto's is usually diagnosed by abnormal thyroid labs. In Hashimoto's, the thyroid microsomal antibodies will be elevated, the thyroid peroxidase antibodies will likely be present, and thyroglobulin antibodies will possibly be present. You'll want to closely monitor vitamin and nutrient labs for your Hashimoto patients. Let's talk about some micronutrient concerns. First, zinc, copper, and tyrosine. These are important for TSH production and conversion of T4 to T3. Some patients may benefit from 2 milligrams of copper supplement and 2 milligrams of zinc picolinate supplement. Tyrosine may interact with thyroid medications, so instead of supplementing, consider adding spirulina, egg whites, salmon, or turkey to the diet. Eating a variety of foods will help meet the patient's nutrient needs. Other nutrients that are going to be a concern in Hashimoto's patients include vitamin A and iron. Hashimoto's patients may have difficulty converting beta-carotene into retinol. Retinol-rich foods include cod liver and egg yolks. Your orange fruits and vegetables are going to be rich in beta-carotene, and you can recommend a supplement of 5,000 international units, but no more than 10,000 because you can have vitamin A toxicity. Thyroid peroxidase is an iron-dependent enzyme, and patients are usually iron deficient due to decreased absorption. Iron-rich foods include leafy greens, legumes, and chicken. Some studies show patients benefit from 50 milligrams of iron bisglycinate per day plus 250 milligrams of vitamin C to help increase absorption. Make sure you separate iron supplementation from thyroid medication by 4 hours because it can interact with the medication. Vitamin D deficiency is associated with Hashimoto's disease, and labs may not reflect the patient's vitamin D status. Patients often benefit from supplementation of 1,000 to 5,000 international units per day. Atrophic gastritis is common in Hashimoto's patients, which can lead to B12 deficiency. If supplementing with B12, supplement with methylcobalamin. Animal proteins, as well as fortified cereals and nutritional yeast, are rich in vitamin B12. Selenium protects from oxidative damage and is required for thyroid function. Adequate selenium may improve antithyroid antibodies in Hashimoto's patients. 2 Brazil nuts per day or supplementation of 200 micrograms of selenium may help decrease thyroid peroxidase antibodies, but do not take high levels of selenium because it can cause thyroid problems. Also avoid supplementation of iodine because it can make thyroid symptoms worse. Goitrogens in large amounts can also impact thyroid medication absorption. Soy and millet are rich in goitrogens, And for Hashimoto's patients, these should be limited to 2 to 3 servings per week because they can inflame the thyroid. Tofu, edamame, and tempeh are safer than processed soy because they are less concentrated. Other foods that are goitrogens include broccoli, cabbage, Brussels sprouts, cauliflower, bok choy, and kale, as well as canola, turnips, watercress, arugula, radish, tapioca, and nitrates. Avoid juicing these foods and consider cooking these vegetables to decrease their impact on the thyroid. Coffee can decrease thyroid medication absorption as well as iron absorption, so separate the intake from medication by over an hour. One cause of Hashimoto's disease is a leaky gut, otherwise known as intestinal permeability. The causes of a leaky gut include SIBO, small intestinal bacteria overgrowth, fungal infections, gluten sensitivity, and other food and environmental triggers. If you can find the cause of the leaky gut, you can find the best treatment for your patient. SIBO is caused by low stomach acid, so a treatment could be increasing protein and apple cider vinegar before meals. Other possible treatments include a FODMAP diet, rifaximin, which is an antibiotic, antimicrobial herbs, and turmeric. Avoid artificial sweeteners in these patients. Treatment for fungal infections include a low-carb diet with fermented food, fish oil, vitamins B, C, and E supplementation, tea tree oils, coconut oil, pomegranate, and garlic. Other solutions could be decreasing stress, testing stool for parasitic infection, taking digestive enzymes with pepsin and betaine, and supplement with glutamine. Possible food triggers for patients with Hashimoto's include gluten, dairy, and possibly corn, rice, nightshade vegetables, eggs, nuts, and seeds. You may want to consider an autoimmune protocol diet for patients with Hashimoto's. First, you'll eliminate grains, legumes, dairy, eggs, nightshade vegetables, nuts, seeds, refined sugar, refined oil, food additives, food chemicals, coffee, and alcohol. So it's a pretty long list of foods, and you'll do this until symptoms improve. Then slowly add one food back at a time. During the elimination phase, incorporate healthy fats and oils, fruits and vegetables, fish, lean meats, root vegetables, and organ meat. Patients with Hashimoto's are more prone to oxalate buildup. Oxalates may increase inflammation, causing an autoimmune response. Oxalate sources include spinach, rhubarb, rice bran, buckwheat, almonds, potatoes, and navy beans. To help with oxalate buildup, increase fluids and decrease sodium to less than 2,000 milligrams per day. Alternative therapies include glutathione supplementation, probiotics, stress management, omega-3 supplementation in doses of 2,000 milligrams per day, a low dose of naltrexone, and proteolytic enzymes that can break down inflammatory cytokines. Be aware that blood thinning can occur with omega-3 supplementation, and naltrexone can be a hunger suppressant, so you'll want to monitor your patient's intake. So here's a basic overview. My recommendation, as always, is that patients eat a variety of foods. So for Hashimoto's, a patient may benefit from a high protein diet that's low in refined carbs and high in non-starchy vegetables, other than those goitrogens we talked about. You might want to try a gluten-free diet and a dairy-free diet, and supplementation with omega-3s, iron, and vitamin D. Recommend the patient take probiotics, reduce their stress, and avoid PFAS and BPA. Continue to monitor their vitamin B12, vitamin D, vitamin E, iron, copper, iodine, selenium, zinc, and calcium status, and supplement as needed. Thank you for watching, and if you have any questions or any videos you would like to see in the future, please comment below. Thank you!